How has your experience in hospitality or other industries as well influenced how you think about healthcare?
So in hospitality, we focused a lot on customer loyalty. That was a big initiative. I was part of the team that launched Marriott Bonvoy. And so with that, it was understanding what motivates or necessitates a need for someone to travel and intercepting that at key moments in order to drive consideration, preference, and ultimately more stays. We looked to, part of that loyalty proposition was rewarding that behavior as well. And so loyalty members get benefits. So things like free Wi-Fi at a basic level, and then more attractive benefits. The more often they stay, the more points they have, the deeper their loyalty is. So there was a real movement, 5 or so years ago towards experience platforms where we could really deliver these once in a lifetime experiences to loyalty members and really, reward that loyalty. We often talked about, that business traveler, that road warrior, who might spend 200 nights a year on the road staying at, a mid-level hotel. Well, then it was, we wanted to make sure that they had the option to, cash in those points to, take a vacation at a luxury property if that was what interested them, and so really trying to make sure those benefits could be really specific and customized to the loyalty member, to the traveler, and sort of what they would find valuable in a particular moment. That is not something we can duplicate in healthcare exactly, but I think we can take some key learnings from that. Yeah. So, for example, how we retain and leverage customer preferences. Our clinicians really try to understand what matters most to a patient so they can help address or remove any obstacles that might be standing in the way of the patient being able to focus fully on their care. And so if there's an opportunity for us to take away a point of stress so that that patient can focus fully on getting better, we want to do that. And that is something that, can drive loyalty. Another another learning is giving them options. A traveler might prefer, like I was saying before, that mid-tier hotel for business, but they want to splurge on something like an experience or a luxury property when they're with their friends and family. And they should get that choice. And in healthcare, I think we need to look at what choices can be meaningful to our customers, our patients, and, whether that be appointment times, like happening in the evenings or the weekends, or communication via a chat instead of having to pick up the phone. And so, high level, yes, we can sort of adopt learnings from the loyalty value proposition, even if it's not sort of a one-to-one comparison. I think the really awesome thing in healthcare is at the end of the day, we're improving someone's life. We're helping them get back on their feet, get back to living, get back to feeling good. And what we find is our patients are incredibly grateful. And that is what drives loyalty. It isn't transactional in healthcare. In fact, it can be quite transformational.